and today I'm giving you 9 silent kidney disease symptoms hiding in your skin. Number 7 will make your skin crawl. Most people associate kidney disease or kidney failure with symptoms like fatigue or urine changes. But did you know that your skin could be talking to you? That's right. The largest organ on your body, your skin, could be sending you hidden messages of kidney disease. As a board-certified kidney doctor, I have countless stories of how skin has shown me that a person might have kidney disease. I remember one patient in particular who showed up to the ER. She was young, she looked pretty healthy, but she had not been to the doctor in years. And she was complaining of severe itching of her skin. She had tried everything. She changed her lotion to one that had no color, no fragrance. She changed her detergent. She changed the soap that she used. She even started taking antihistamines, but still her skin was itching, an itch that she just couldn't stop. Sure enough, after I finished talking to her and examining her, even before the lab work came back, I knew that her skin was telling her that she had kidney disease, and she did. Her skin was talking to her. I am an Atlanta board member of the National Kidney Foundation, NKF. And according to the NKF, approximately 37 million Americans have kidney disease, and 90% don't even know it. That's right, 9 out of 10 are unaware that they have kidney disease. So what does this mean? This means that I need to give you more tools to recognize if you have kidney disease so that you can possibly pick it up early and get it treated early. Okay, I do get a little bit hyped when it comes to kidney disease prevention, but not to worry because I'm about to give you some life-saving information. We're about to discuss 9 silent kidney disease symptoms that could be hiding in your skin. Number 1, persistent dry, itchy skin, or pruritus. This is a big one. It makes my patients miserable when they have kidney disease and it's presenting with the symptom of itching. It's not just a run-of-the-mill itch. It's an itch that can be all over the body. It can be in certain portions of the body, and the scratching can be so intense that it actually breaks the skin. You get excoriations, and you can actually get infections. It can be caused by different things. So certainly the kidney disease. If you have kidney disease, you get a buildup of toxins. Some of those toxins can cause your skin to be very dry and itchy. Your kidneys are also responsible for filtering out excess phosphorus in your blood. Well, if you get a buildup of phosphorus, the phosphorus in particular can make your skin itch severely. In fact, in the example that I gave earlier about the patient I saw in the ER, it was a high phosphorus due to kidney failure that was causing her skin to itch. Other things that can happen if you have some nerve issues due to uremia or a buildup of kidney toxins, that can cause your skin to itch as well. So if you have this very dry, itchy skin, consult with your doctor because it could be a hidden symptom of kidney disease. Number 2, extreme skin dryness and roughness, or xerosis. Yes, you can get extremely dry skin, and that also might be a warning symptom of kidney disease. When you have a buildup of toxins in the body, this can sometimes damage your sweat glands and your oil glands, and it can lead to very dry skin, even scaly skin. It might look like fish scales. And so if you're getting very dry skin, check with your doctor because it could be a hidden symptom of kidney disease. Number 3, unexplained rashes, bumps, blisters, or sores that do not heal. If you have kidney disease and you have an increase in the toxins in your body, then your immune system might respond to those toxins and try to attack them, even in the skin. And so if you're getting bumps like these dome-shaped bumps that change and start to look like crusted lesions when you scratch them, that could actually be a symptom of kidney disease. Also, if you get blisters or little fluid-filled bumps that sometimes turn into open sores that heal very slowly, if you have kidney disease, especially advanced kidney disease, then oftentimes the blood flow to the skin is not adequate. And so if you don't have adequate blood flow to the skin due to blockage of vessels that supply the skin, then you could be slow to heal and you can get poor wound healing or even blisters that form because of the poor circulation. So just be careful, pay attention to your skin, and if you're getting rashes, bumps, blisters, or sores that do not heal, run. Don't walk to your doctor. Number 4, skin discoloration, or a yellowish, grayish, or darker hyperpigmented skin. So when kidney toxins build up, then yes, it can be reflected in your skin. You can get a yellowish hue to your skin. Now, this is different than jaundice. And we know that jaundice is a yellow color that can come about with liver disease, but this is actually due to a buildup of kidney toxins. Either way, if you have yellow skin, you need to get your kidneys and your liver checked out. Also, you can get a grayish skin color still due to the buildup of toxins in your skin, or you can get some points of hyperpigmentation, meaning your skin is darker than what your natural skin tone is. It can be for different reasons. You know, you can have a buildup of toxins or electrolytes like phosphorus, and you can get skin patches that way, or you can just get a diffuse or generalized darker color than normal. I bet if you think about it, you've probably already noticed some skin discoloration in patients you know who are on dialysis. And that's because when we have you on the dialysis machine, we use the dialyzer or the filter and we get rid of a lot of the excess toxins in your body, right? But the filter can sometimes get rid of some of the vitamins as well, some of the vitamins and the nutrients that help to give your skin that supple feel and that normal glowing color. And so sometimes dialysis patients will have a skin color that's a little bit ashen, grayish, or darker. And remember, depending on a person's natural hue, it may be more difficult to pick up the skin discoloration. Question. After watching this video, please tell me one thing you will do this week in order to pay more attention to your kidney health. Please comment down below. Number 5, swelling or edema. Yes, if you get a swelling in your skin, especially around the hands, the feet, the ankles, or even around the eyes, this could also be a hidden symptom of kidney disease. You know that your kidneys are responsible for filtering out excess toxins. Yes, they're also responsible for filtering out excess fluid. And so if your kidneys are not working properly, then you might get a buildup of fluid and it will show up in your skin as swelling or puffiness. Also, if your kidneys are leaking out excess protein, this could cause swelling. It is normal for you to have zero or very little amounts of protein in your urine. But if you have kidney disease, then your kidneys might be leaking protein. And so if they leak protein, this could cause you to swell. Number 6, nephrogenic systemic fibrosis. Now, this is a tricky one. It's actually a rare condition, and it typically occurs in patients who have kidney disease, whether they know it or not, after being exposed to the contrast dye used for MRIs. And it's with gadolinium, but it's with one of the older forms of gadolinium in group 1 that has been used for MRIs. So if you're a person with advanced kidney disease and you get this contrast dye, it can lead to literally a fibrosis of your skin. And so it can present with very stiff, tight skin, almost like someone who has scleroderma, if you've heard of that autoimmune disease. The skin might be really shiny. It might be kind of hard or woody. It can even look like an orange peel, you know, those kind of open pores, and it can be uncomfortable and kind of difficult to move. You can get the nephrogenic systemic fibrosis symptoms within days of getting the gadolinium, or it can be months or even years before you get the symptoms. Fortunately, now with some of the newer forms of the MRI contrast, we're seeing NSF less and less. But if you do have tight, woody, shiny skin that's really stiff, and you've had an MRI with one of the older versions of the contrast gadolinium group 1, beware, because this could be your skin telling you that you have kidney disease. Number 7, uremic frost. Now, this one might make your skin crawl. Fortunately, it's very rare, but if you have very advanced kidney disease and you get a buildup of toxins, specifically urea, then you can get uremic frost. So here's what happens. If you have high urea and you sweat, okay, you have sweat, you have moisture on your skin, well, once that sweat dries or evaporates, then very high urea can crystallize and actually form a white powdery substance on your skin or white crystals on your skin. And we call this uremic frost. If you see this, oh, it's an urgency or even an emergency, and you need to get to a doctor quickly, okay? If you see someone with uremic frost, more likely than not, they have very advanced, severe kidney disease, and they may even need renal replacement therapy like dialysis. Number 8, calciphylaxis. This is a rare but very serious skin condition, and I've seen this many times, unfortunately, throughout my career as a kidney doctor. So calciphylaxis is a skin condition that occurs when calcium deposits cause a blockage of the blood vessels that supply the skin. And this can cause the skin and the tissue underneath to die or necrose, and you can get open sores, very, very painful sores. All of my patients with calciphylaxis complain of severe agonizing pain. And these sores can turn red, gray, black, and the skin can get very, very hard and uncomfortable. And some of the skin tissue, especially with the blood vessels being blocked, can actually slough off and you can lose portions of your skin. I've had patients who've lost fingers and actually needed skin amputations in order to stop the calciphylaxis from spreading to the rest of the body. I've had male patients, and listen to this. I've had male patients who have had to have penectomies. Yes, I said penectomy, meaning they've had to have their male organ removed due to severe calciphylaxis. So patients, when I tell you to please pay attention for kidney disease, it can have some consequences that you just don't want to deal with if you're not careful, okay? So make sure you're consulting with your doctors. At any rate, with calciphylaxis, unfortunately, there is a high fatality rate because a lot of these skin lesions can become infected and patients can get severe, overwhelming infection or sepsis or even septic shock. So if you see lesions on your skin that start off as perhaps open sores and then get very dark, black, reddish, and if you just aren't sure what the lesion is, please consult with your doctor because if it's calciphylaxis, this could be one of those hidden symptoms of kidney disease. Number 9, don't forget about the nails. Nail changes can be a warning sign that you have kidney disease. You can get something called Lindsay's nails or half and half nails. That's when the nails are white on the bottom and they're pink or dark or brown up top. You can also get some horizontal lines that are not quite normal, and that can be a warning that you have kidney disease. You can get spoon-shaped nails, okay, and very brittle nails. That can also be a warning sign of kidney disease. So just make sure you pay attention to all of your skin, including your nails, and so that these hidden kidney symptoms don't hide from you.